This video is to demonstrate the movement of the oblique muscles. There are two oblique muscles, namely the superior oblique muscles and the inferior oblique muscle. Now, if you look at the course of the superior oblique, you can see that the superior oblique is arising from behind. Then from there, it is coming forwards like this, and with the trochlea, trochlea is in the front, that is in front and medially. Medially means towards the nasal aspect. Now from there it hooks around the trochlea and goes backwards like this, backwards, and it goes even behind the vertical axis of the eyeball and get inserted postero-superiorly here. You get inserted postero-superiorly. So this is the course of the superior oblique. Now let us see what happens if the superior oblique contracts. Now let us look at the axis and look at the movements. Now you have the vertical axis here. This is the vertical axis. The vertical axis is here. So if the oblique contracts and the tendon goes behind the vertical axis, it is definitely going to abduct the eyeball. So abduction is one movement. Number two, it is pulling the eyeball forwards. So if the eyeball is pulled forwards, the action which is going to happen is in the transverse axis, and the action is going to be depression. Okay, so that is number two action. Third action is, as you can see, the pull is towards the medial side like this. So if the superior oblique contracts, the movement is medially in the anteroposterior axis. So that is called as a intorsion. So by this we can understand the superior oblique movements are abduction, intorsion and depression.